Gomez. My name is Natasha. I'm going to be your nurse for the day.
Hello.
How are you doing today?
I'm good. How about yourself?
Good. How have you been?
Good. I actually just celebrated my 65th birthday.
Wow, 65.
Yep, big number.
All right, so what brings you in today?
I'm just coming in to do my regular eye exam.
Okay, I see in our records you haven't been here for 5 years.
Yeah, I didn't have any problems until recently. I feel like I can't see things around the sides. In fact, I almost got into a car accident because I couldn't see my blind spot.
Oh, wow.
So I figured maybe it might have something to do with it.
So when you say you can't see things on your sides, is that both sides or just one side?
Both sides.
Both sides. Okay. Just a few questions for you. Have you had any history of heart disease?
No.
What about history of hypertension?
Yes, I do have hypertension.
Are you taking any medications for that?
Yes, I'm on metropolol.
Okay. Diabetes?
I have type 2 diabetes, and I'm taking lab tests for that.
Okay. Have you had any recent eye injury?
No.
Family history of glaucoma?
Yes, my mother has glaucoma.
Okay. How old was she when she got diagnosed?
She was about my age, about 60, 65.
Okay. Are you noticing any colored halos that you see when you look into the light?
No.
What about pain that radiates to your eyebrow?
No, no pain.
Okay. Well, based on these results, I'm going to be doing a test right now called the confrontation test. It's a very simple test. You can remain seated.
Okay.
But basically, we're going to cover one of your eyes, and I'm going to bring my pen light in from the side, and you're going to let me know when you see it.
Okay.
So you're going to cover your right eye, I'm going to cover my left eye, and just let me know when you see my pen light.
Okay. I see it.
Okay.
Right.
Same drill, other side.
I see it.
Okay. All right. So I will go let the doctor know, and he will be in a little bit.
Okay, thank you.
You're welcome.
Hi, my name is Hans. I'm the doctor here.
Okay.
The reason I'm here today is because I just got your results from your questionnaire from the nurse, Krishna, that was here earlier. And based on this questionnaire, it shows that you have a family history of glaucoma.
Yes, that's correct.
And also your chief complaint is that you have loss of peripheral vision. Okay, and I also see that you have a history of hypertension and diabetes, correct?
Yes, I do.
Okay, well, based off these results, there is a really good chance that you may have glaucoma, but to further verify that, we're going to be doing some diagnostic exams to confirm that, okay?
Okay.
So the first exam that we're going to be doing is called we're going to be testing your visual field.
Okay.
Okay, pretty much how that works is that you're looking at an image, and you can describe to me what you see within the image of your field, what you see.
Okay.
Okay. Somebody who has glaucoma, they have a narrow field, so they would only be able to describe a certain portion of the image, as opposed to somebody with normal vision, they could be able to see a broader image or a broader of a picture.
Okay.
Okay. If that doesn't work, I mean, after we're done with that exam, we're also going to be doing the tonometer.
Okay.
The tonometer, all that does is pretty much evaluate the pressure within your within the eye.
Okay.
Somebody who doesn't have glaucoma would have a normal eye pressure of 10 to 21.
Okay.
Okay, so anybody that would have anything above that, let's say above 30, that would have open. Anything above 50, that would have closed. So we're gonna go ahead and do that procedure, okay?
Okay, sounds good, doctor. Thank you.
Good afternoon, everybody. My name is Hans Herring, and today I'm going to be talking to you a little bit more about the pathophysiology of glaucoma. And with that being said, let's go ahead and focus on this, which is a little presentation that I made. So glaucoma is a group of eye diseases in which the optic nerve is damaged, leading to irreversible loss of vision. In most cases, this damage is due to an increased pressure within the eye. The eye produces a fluid called aqueous humor, which is secreted by the ciliary body into the posterior chamber, a space between the iris and the lens. This then flows through the pupil into the anterior chamber between the iris and the cornea. From here, it drains through a sponge-like structure located at the base of the iris called the trabecular meshwork and leaves the eye. In a healthy eye, the rate secretion balances the rate of drainage. In people with glaucoma, the drainage canal is partially or completely blocked. Fluid builds up in the chambers and is increased pressure within the eye. The pressure drives the lens back and presses on the vitreous body, which in turn compresses the blood vessels and the nerve fibers running at the back of the eye. These damaged nerve fibers result in patches of vision loss, and if left untreated, may lead to total blindness. So there are two main types of glaucoma. There is open angle glaucoma, and then there's closed angle glaucoma. To start off, I'm going to be talking to you a little bit more about the open angle glaucoma. Open angle, that's the most common type there is. It's progressive, so it happens over time, and the only symptom you'll find is loss of peripheral vision. So by the time it's detected, it's already too late, because they normally come in because, vision loss, or there's a decrease in peripheral vision, so they go to get checked, but by then it's already too late. So this normally affects both eyes. But what does open angle mean? Well, to better help you illustrate, I have this little picture right here that will better help show what open angle means. So open angle means that the eye's drainage angle is wide enough for fluid to reach the drainage holes, but the holes themselves may be clogged. When fluid can't drain out of the eye, pressure in the eye slowly rises. This leads to optic nerve damage and vision loss. So now I'm going to be talking to you about closed angle glaucoma. So remember how open angle, that was most common. So closed angle isn't as common. It only affects one of the eyes, and you'll know you have it because you have intense pain on one of the eyes, because again, it only affects one side. And it's all of a sudden. So it isn't like the other one where it's progressive over time. This one's a sudden attack. And the reason it only affects one of the eyes is because of the reduction in the outflow of aqueous humor that results from angle closure. Usually this is caused by the lens bulging forward as a result of pupil dilation in a patient with anatomically narrow angles. So to better help you understand what I'm talking about, I have a little picture right here. So this is explaining a closed angle glaucoma. With closed angle, the iris blocks the drainage holes, so there isn't anywhere for the aqueous humor to flow, so normally it's going to start building up a lot of pressure within the eye. So the more pressure that you have, there's less vision and there's a lot of pain. Since fluid can reach the drainage holes, pressure in the eye quickly rises. This causes a painful attack. An attack most often happens in one eye at a time. This may appear red. You may have severe headache, nausea, and intense pain, or you may also have a blurry vision. If you notice any of these signs, you have to call 911 or an emergency service right away, because this is an emergency situation. If you don't take care of it right away, you may even go blind within 24 hours since the attack. So this is an emergency, and you have to call somebody right away if you start getting eye pain, one eye. Good afternoon, Ms. Gomez. So I just got the results from your tonometer exam.
Okay.
It shows that your results were at a 32.
What does that mean?
Well, normal IOP, the intraocular pressure is between 10 to 21. So yours is slightly elevated at 32.
Okay.
The results also indicated that it's on both of your eyes. So you are losing peripheral vision on both eyes. Also, this confirmed that you have open angle glaucoma.
Open angle?
Open angle glaucoma, yeah.
Okay.
To be diagnosed with open angle, it has to be between 22 and 30, and again, this was at 32. So you are confirmed for open angle glaucoma.
Okay, and what is gonna happen? What am I gonna do with it? Do I go blind?
You may go blind over time, but that's why you're here today, so that I could try and prescribe something to you, not to stop it, but to slow the progression.
Okay.
So what I'm going to be giving you is I'm going to be giving you some eye drops. It's called Carbical.
Okay.
Pretty much what these eye drops do is decrease the pressure within the eye.
Okay.
Because the whole point of glaucoma is too much pressure within the eyes. So if I could be able to bring down the pressure, you'll be able to see a little bit more and, you know, slow down the progression of the glaucoma.
Okay.
If let's say the eye drops don't work, you're still having the same issues, come back to me and I could give you some other types of meds. And if let's say the tablets that I gave you don't work, you know, we could also do something more progressive and give you some type of surgery. There's two types of surgeries that are used for the glaucoma. One of them is the ALT, which is the argon laser trabeculoplasty, which is it's non-invasive, and they pretty much they will go in there and will try and remove some of the narrowing, so that you could better flow could be going into your eye of the aqueous humor.
Okay.
And the other one would be the trabeculectomy.
Okay, but that's if only the medication doesn't work.
Oh yeah, definitely. But we'll start you off with the eye drops, and you know we'll go from there.
Okay, sounds good, doctor. Thank you.
Do you have any other questions for me?
No, that's all.
Okay, all right. So what I'm gonna do right now, I'm gonna get the nurse, and she'll explain to you how to put on the eye drops and signs and symptoms of, you know, possible indications that, you know, having an allergic reaction to the eye drops or anything. Okay.
Okay, sounds good. Thank you.
Hi, Ms. Gomez, it's me again.
Hello.
I have your medication.
Okay.
So the doctor's prescribed Carbical,
Okay.
which is an eye drop. It's a mitotic eye drop.
Okay.
And basically it just facilitates aqueous flow to help reduce your intraocular pressure in the eye. Side effects of this include blurred vision, diarrhea, headache, and you also may have a hard time adapting to the dark light.
Okay.
So I have for you this little pamphlet that actually explains glaucoma in depth and talks about your procedures, your surgery, also how to use these eye drops, which I'm going to go over right now, and you can follow along.
Alright.
So you're going to tilt your head backwards, and you're going to use your index finger to pull down on your lower eyelid. You're going to put one drop in,
Okay.
and then close your eye, and press the inner corner of your eye, and hold it for 3 minutes, 2 to 3 minutes.
Okay.
Don't wipe off the fluid, and don't continuously blink. Just close your eyes once, put pressure, and keep the pressure there for 2 minutes.
Okay.
Can you show me how that works?
Yes. Okay. So you want me to pull this lid down, put one drop, just close my eye, and then just put pressure for about 2 minutes, right?
Yep.
Okay.
And you're going to do it for both eyes.
Okay, perfect. What happens, okay, yeah, go ahead, sorry.
Did you have a question?
No, go ahead. I have the pamphlet.
Okay. So when you go home, you just want to make sure that you're taking your medications as the doctor has prescribed. So don't just stop taking it because you think you don't need it. And if you do miss a dose, go ahead and take this as soon as possible and then continue back with your regular schedule. You can even set an alarm on your phone if you want to remind you when to take your medication.
Oh yes, that's what I was going to tell you. What if I forget to take it? So it's okay to take it at a random time and then just start over again where I left off?
If you miss a dose, take it as soon as possible and then start again.
Okay, perfect.
But try to take it on a regular basis.
Okay.
Also, you want to come in regularly for eye visits 3 to 4 times a year.
Okay.
Come in to get your eyes examined. And since it is a hereditary disease, if you are noticing visual changes in your family members, tell them to come in and get their eyes examined also.
Okay, definitely will do that.
If you have any questions, this pamphlet has a whole lot of information, and if it's not in here, you can feel free to call our office, and one of us will be able to help you.
Okay, thank you so much.
You're welcome. Good luck.
Thank you.